Next up we have Jon Rouse to speak with us. Jon, of course, is the Chief Officer for the Greater Manchester Health and Social Care Partnership since July 2016, leading on the transformation of health and care services. Previously, Jon was Director General for Social Care at the Local Government and Care Partnership at the Department of Health, and his other previous roles include Chief Executive in the London Borough of Croydon, Chief Executive of the Housing Corporation, and Chief Executive of the Commission for Architecture and the Built Environment. Jon is going to talk to us about the journey ahead, following on from Andy's comments. Please join me in welcoming Jon Rouse, please.
Greater Manchester under health and care devolution actually is. How countercultural, how paradigm shifting, how mind-bending what we're actually doing. The audacity of a city region, and it could only have been this city region, to say after 70 years, actually it's time to bring our NHS and local democracy together and actually to bridge that divide that has existed since the post-war settlement. That actually we've had enough of 20 years of trying to turn our NHS into some version of a marketplace. And actually we now want to emphasise collaboration more than we want to talk about competition. That we want to change the decades of hierarchical decision making that starts from Whitehall, and remember I've been there, so I know, and cascades decisions down about people's lives, which actually those people in Whitehall can't possibly understand or interpret or know about, and to say actually we want to take those decisions ourselves, not just actually us, but actually the people who experience those services, to actually genuinely embrace a doctrine of subsidiarity in the way that we design and operate our system. Big changes from an emphasis on competition to collaboration, from a shimmer of patient choice to something which is about genuine personal control, to change from segregation of organisations to integration of care in the way that people experience it, to avoid prescription and move to a much more creative approach which is holistic, which is about the whole person, which is about medical, social, emotional, etc. And which is about an invitation to all of the workforce across the health and social care landscape, but actually beyond as well, deep into our voluntary and community sector, and also deep into the public services, and to invite them to actually connect with what we're doing, for each of them to be able to be leaders in their own right, to be researchers in their own right, innovators in the way that they go about their work. That's why I stuck up that film clip to start with, because I think it's one analogy, and I'm going to use several in this speech, but that idea of jazz, that it's always on the edge, the creativity of it, the way that we bring all of our individual skills and our organisational capabilities and capacities to bear, and we combine them, and that there is a tension in that, but it can be a really positive, creative tension in the way that we go about our work. And if all of that wasn't audacious enough, we're trying to do this in the fiercest of headwinds. A financial headwind, which is only going to get stronger over the next 2 or 3 years. At a time of workforce shortages in critical areas, in key areas that are not going to be easily resolved and are going to need a huge amount of creativity as we work our way through those realities. And a legislative backdrop, which, let's be honest, is not helpful to us in terms of the paradigm that we are trying to create and the type of system that we want to operate in Greater Manchester. So we're now 18 months into this journey, and we have some notches on our belt, but we also have some scars from that process as well. We're learning as we go. We're making mistakes, but we're learning from them. We should be proud of our first year performance. There are many out there who probably thought that we would fall over. Without all that scaffolding of the national hierarchical systems, that we would fall flat on our face. And we didn't. We outperformed the national picture. We did so financially in a big way, and indeed ended up bailing out the rest of the country in terms of its financial position. But we also maintained a lot of other critical areas of performance as well, and we even took areas where we were starting from a very low place, mental health being a very good case in point, and we started to make progress, and we started to meet targets and improve our performance. Not to pretend for a moment that we haven't got a long way to go, and not to pretend for a moment that it isn't going to get harder this year and in subsequent years. But nevertheless, we proved that a system of mutual support, mutual challenge, mutual accountability can work at least as well, if not better, than a top-down hierarchical system. I think we also have begun to mark our territory. We've started to use the freedoms we have to show that we do things differently in Greater Manchester, and we make different choices. Some of that work was already underway. I don't want to pretend for one moment that everything started the moment that devolution arrived on the 1st of April 16. What we've done with our acute stroke services and the work of that network in Greater Manchester has been truly remarkable. To have every one of those services now as A-rated and to have the highest performing network in the country. If you've been involved in that in this room, we just want to say a huge thank you and well done. That is truly transformational and impactful in terms of patient care. The work that's gone on in our first year of being responsible for mental health in rolling out proper eating disorder services across Greater Manchester, again operating truly as a network, learning from one another and working between themselves on a collaborative model and a collaborative basis. Again, if you've been involved in that work, thank you. Making a decision that we were going to have standardised guidance and practice around identification and treatment of ADHD across Greater Manchester. Nobody else is doing that. There's not a national standard or target that tells us to do that. That was our choice. It was something we decided to do. Or reflecting the diversity of our communities and partnering with the LGBT Foundation to work with primary care, particularly GP practices, so we learn together how to provide better, more appropriate, more accessible services for that community within Greater Manchester, and of course that's ongoing work as well. I love the fact that we, in our first 18 months, have sweated the big stuff and the small stuff. So at the big level, we've taken on and we've delivered the biggest merger of two trusts in the country. And that has been an extraordinary effort by everybody involved, all of the workforce, the leaders, all the people who have made that possible. But it wouldn't have been possible if it wasn't for the Greater Manchester context in which it sits and the story we're able to tell about where this fits within our overall devolution journey. And then at the very sort of smaller level, working with the voluntary and community sector to embed care navigators, social workers and others deep within GP practices to work with the most marginalised in our community and to actually say to them, we know that your needs are not just medical, they are social, they are emotional, they're about your family, they're about your support structure, and we're coming on that journey with you. And we'll do it primary care led, but we're going to put a whole team alongside and work with you at that micro level, deep within communities, deep within households. So in our first year, we've had programs that have sought to address the sort of the milk teeth of our smallest children, right through to improving nutrition and hydration for the frail elderly at the end of life. That life course approach is one of the things that has characterised the way we work. So we've set our priorities, we've made most of our plans now, and I think they are genuinely of the people, for the people, and I think we've genuinely tried to make them about all the people and recognise the need to tackle the inequalities which are deep within our society. Just need to switch slide. Can we switch slide? Brilliant, thank you. But it's now going to get a lot tougher, a lot harder. The headwinds are going to get stronger. The financial position over the next couple of years is going to get tougher unless government brings some relief across NHS and social care. And of course, there's some stuff that isn't working. There is some stuff we haven't got right yet that we're still grappling with. We're still trying to get our digital strategy right. And let's not pretend, when it comes to digital integration, we are behind significant other parts of the country. We've still got a huge amount of work to do around workforce engagement. And for people deep within our workforce to really feel that they're part of what we're trying to do under devolution, we're not properly connected with them yet. And that's something that we do need to address. And it's got to be meaningful for them in a way that actually impacts on their working lives. But I think the biggest challenge, is about the expectations we've set that we've now got to deliver on. And the real challenge to us there, the headwind which is going to grow, is that the challenge that provides to us as leaders and the other people in this room around values, around trust, and around behaviours. Because as we move deep into this delivery phase, and it's a delivery phase in the most extraordinary scale, both in terms of breadth and depth, let's be honest with ourselves, all sorts of tensions are going to arise. And the reason is because the organisational rhythms that you are part of day in, day out, within your own organisations, with your own cultures, your own governance, are going to come into, if not conflict, then at least tension with the broader paradigm shift that we're trying to achieve. If we're going to navigate that landscape, then we're going to have to do so with open hands. There is going to have to be give and take, call and respond. We're not just going to have to anticipate our own needs, we're going to have to anticipate other people and other organisations' needs, and we're going to have to own them in the way that we own our own. We're going to have to walk in other parties' shoes and understand what they need and what their perspectives are, and look for that win-win in the way that we structure our programmes and we structure our delivery. It will mean extending trust, and that can be risky sometimes because you don't know that it's going to be reciprocated. It means that we have to believe the best of each other and of each other's organisations as well. We're going to have to be generous of spirit, encouraging, affirming in the way that we relate to one another and the way that we go about our business. We've got some really hard decisions that lie ahead, really tough stuff that we've got to transact. During that period, some parties are going to slip, they're going to slide. We can't let them fall away. We have to hold them and we have to bring them on that journey, and that means lending support at the right time. As we journey on together and this climb gets steeper, there is a maxim for all of us, which is about collective ownership, about owning the whole of taking charge together, the whole of our plan, taking an interest in all of it. And that's why we brought you together today. That was the reason why we wanted you all in one room. We won't do this very often, but it was so that you could see each other and you could recognise that we are all of this, doing this together. You know, whether you're a patient representative here today, a service user representative, a carer, voluntary and community organisation, a GP, a pharmacist, dentist, acute physician, whoever you are making a contribution. And you may not know everything that's going on in this room and all the things that the other people are doing, but I want you to feel a sense of ownership of it and to feel that you are part of this collective. We're not there yet. I see some signs of that degree of collaboration and trust and mutual support, but not all of the time. I can think of instances in the last year where organisations have really started to struggle, either financially or performance-wise, and I haven't really seen the degree of reaching out to those organisations and to that leadership to actually say to them, what can we do? What can we offer you? What support? How can we hold you up at this time? How can we make sure that you come on this next stage of the journey with us and that you don't fall behind? We need to be genuinely rowed together and to behave as if we're rowed together. We can't leave people stranded on the mountain. Next slide, please. When I had my interview for this job, I used the analogy of total football. It doesn't matter if you don't like football. All you need to understand is this, that in the 1970s, a team called Ajax from Amsterdam invented a new way of playing the game. And it was revolutionary at the time because they said, we don't really think of this as one player in one position doing one job. Actually, all of the players have to own what the whole of the team is doing all of the time. So if one player goes forward, I expect another player, whatever the number on their shirt, to fill in terms of that position. We move up the field together, we press together, we fall back together, we interchange, we look for space, we look for the person in space, we connect to one another. And I think it's another very good analogy, and I think it still holds up 18 months later in terms of how we need to work. It's about values. It's about ways of being. But the question is, to do what? Can I just have the next slide, please? So, in the remainder of the time that I've got, I want to say that as well as the how we work together, in terms of the what we do, I think there are 5 main priorities for this next period. All of them are going to be expressed in workshops today, so I'm not going to say very much about each of them, but I do want to land them with you. And push back at me. If you don't think these are the right ones or I've missed one, please do say so. But this is my view, and I think it's the view of my senior team in terms of what the 5 key priorities for the next 12, 18 months are. So the first is, if we're going to transact what we need to transact, if we're going to do the things we need to do, we have to have a commissioning system that is fit for purpose. And we've had a commissioning review, and we've adopted it in the summer, and we've agreed it, and we said this is what it needs to be like. Single commissioning function at the local level. CCGs and local authorities joined up. One budget, probably one management structure, and working out how your governance needs to work together. So you're commissioning once on behalf of the population. And then at GM level, just doing the things that we need to do at GM level that have to be done. And around that, embracing certain key principles, a true commitment to personalisation in the way that we commission, particularly for people with long-term conditions, learning disabilities, going through end-of-life care, and so on. And a genuine commitment to co-design with the voluntary community sector, with patient representatives. Second, a reformed model of care in every neighbourhood. We have made our neighbourhoods, 30 to 50,000 population, our building block for what comes next. We've now got to make that a reality in every neighbourhood. Primary care-led, multidisciplinary team working, great risk stratification to know who it is we need to be proactively caring for. Really strong role for the voluntary community sector in helping us to create that biosocial or clinical social model. 3, our acute services strategy. Diane Whittingham leading us on this journey with Sir Jonathan Michael and others to develop an acute services system within Greater Manchester that optimised clinical outcomes in just the same way as we've already done on stroke care, but for a much wider range of services. But also an acute system that flows logically from those models of care that we're creating within our communities, underpinned by great clinical leadership and a genuine commitment to patient engagement. 4th, we need to reform our urgent emergency care system. After the 22nd of May, or on the 22nd of May and afterwards, the people of Greater Manchester were reliant on us in terms of our response, and I believe we got it pretty much right. And I was incredibly proud of us as a system. The way we worked collaboratively, the speed of our response, the fact that we got good plans and we stuck to them and we delivered on them, great communications and engagement. But that has to be our quality of response every time an individual in Greater Manchester hits crisis, whether that's a mental health crisis or a physical health crisis or both. Our urgent emergency care system has to be that good, that responsive every time, and it's not yet. And then finally, a true and genuine commitment to innovation. Let's not forget why we went on this devolution journey in the first place. Yes, it was about integration of health and care in part, but actually the real reason was because we knew that the health inequalities and the poor health of our population was acting as a terrible drag on the economy and the social contribution that was possible within our city region. That's why we got into this business. And so we need to connect back to that in the way that we structure our programmes, but also how we put our weight behind Health Innovation Manchester and truly become, if not the best, certainly right up there as a life sciences centre, combining the best of industry, academia, our health and care system, bring it all together. It could be so powerful and create so many opportunities, economic, scientific, and health innovation as we go forward. So that's the how and that's the what. There are, of course, many other great things we're going to do. We've got many great plans, many areas that I haven't got time to talk about this morning. But if we are going to be successful, it does mean that individually and organisationally we have to subjugate ourselves to the greater good, to this collective goal. For me and my team, we will help you in terms of being stewards of the system, but you are the leaders who are going to deliver this, not us. We can't do it, there's too few of us for a start. It's everybody in this room and many beyond that could pull this off, genuinely make this paradigm shift and enable us to succeed. I think there are reasons for optimism. Our plans for good Our plans are good, and we've already achieved a significant amount. Whether we succeed or not in the future is up to us. It is about values, behaviours, cultures. We've got the skills. We've got skills coming out of our ears, but we have to combine that with culture and behaviours as well. Pick one of the metaphors that I've used today, jazz or football or ballet corps or climbers, or pick one of your own, whatever inspires you. But find yourself today in this collective effort about who you need to be and how you need to change the way that you do your job in order to contribute as much as you can to this greater cause.